about a couple of things that we reviewed on your delivery when we gave you your appliance. So there's a few things that commonly people forget, and so we just want to remind you. First, please remember with your appliance, I need you to be cleaning it every single day. The cleaner you keep it, the better it's gonna last. I recommend only using toothbrush and soap to clean your appliance, and when you clean it, I need you to clean all the components. Inside, outside, if you have any metal brackets around and in the metal brackets. Like you're cleaning a dish, clean it very, very well. Please do not use toothpaste. Please do not use mouthwash. If you don't want to use soap, you can use a denture cleaner, but I don't want you to use anything else on the device itself, or it can void the warranty. The appliances come with a 3-year manufacturing warranty against breakage or defects. That's manufacturing only. So if you damage it, if the appliance is adjusted for dental work, or if a dog gets a hold of it, that would not be covered by the lab warranty. It would only be covered if you purchased the additional warranty when you took the appliance home with you. Additionally, I want you to keep in mind when it comes to your bite in the morning, okay? When your appliance comes out, you will have a temporary sensation that your bite is different. That is normal, okay? That is a normal sensation. What I want you to do, the sequence of events after the appliance comes out, is first take your appliance out and start your routine. Don't do anything else. Just start having breakfast, waking up, getting your body and your jaw moving. After everything's gotten a little bit warm, then you can do some gentle jaw stretching. Remember, the goal is that you're getting your back teeth back together. You need to have connection in the back. Okay, so a couple of the stretches that you can do is when you're resting your elbows on the counter, you can rest your elbows on the counter and rest your chin in your hands. When you do that, the goal is to allow the weight of your head with some gentle force going back and up towards the ear, gentle force backwards to guide the jaw back. You can hold the stretch with your resting, kind of like the thinker for the jaw, for about 10 seconds. You can also move your jaw side to side and gently open and stretch using your fingers. At no point are you pushing so hard that you're creating discomfort. Everything is a gentle, guided motion, okay? One of my favorite stretches is where I get my thumb in my cheek and I gently am pushing outwards with my thumb to kind of massage this muscle complex that gets really tight back here. After you've been awake for a little bit and you've started to have some gentle jaw movements, if it's been at least 30 or 45 minutes since you've woken up, then you can put your AM aligner in. And with that piece, I would like you to put it in your mouth, bite down gently, and I need you to continue to kind of do a gentle chewing motion until your teeth fully line up, okay? It's not about the amount of time that it's in your mouth. It's about continuing to stretch and chew on the morning positioner until your back teeth come back together. I assure you, if you do not be mindful and do this on a daily basis, bite change will happen, and it will happen so gradually over time that you don't even realize it. So it needs to be a daily activity, and you just need to make sure that the back teeth reconnect. Now, once you're comfortable wearing the appliance through the night, that is the first goal. You need to be comfortable. If you are not comfortable, then you need to come back into my office so that I can address any fit problems that you may have, so I can get you wearing the appliance through the night. After you're comfortable, then our goal is to get the best sleep quality that we can. And what we're looking for is subjective sleep quality improvement. And so what I mean by that is, first and foremost, typically it's snoring. Okay, snoring is an easy identifier. It is quick on, quick off. Okay, if you snored before your appliance and now you're not snoring as much, that's a good indicator. Some good ways to track snoring is using telephone apps like Snore Lab, Do I Snore, Sleep Score, all of these snoring type things. Access the microphone on your phone, and they give us a sense of how much noise you're using. Okay, so snoring is one indicator. Another indicator is fatigue, right? So if you consistently felt that you needed to nap or rest throughout the day and you're having less of that midday, late day fatigue, that's a good sign. However, fatigue sometimes can be a slower thing to come on. So sometimes you've been dealing with this for many, many years. And now once we get you into treatment, it can take several weeks or months before you start to rebound. Okay. For some people, it's less morning headaches. For others, it's better dream recollection. Additionally, some people notice less fragmentation or less waking up throughout the night for bathroom breaks or disruptions, less choking. Those kinds of things are all good signs. So the more feedback that you can provide to me about your sleep quality, the better. If you tell me, I think it's okay, then I'm assuming everything's okay. Okay. Additionally, if you can use any sort of objective measure, right? A smartwatch, a Fitbit, a smart bed, all of those things, Whoop data, Ring data, those can all be very helpful for us to look at your heart rate and your oxygen level to tell us if things are starting to calm and settle down. If your sleep quality is not good, then we need to advance, okay? The goal with advancement is a slow and steady advancement. And so typically, depending on your appliance, and we will give you instruction videos on each specific appliance, depending on your appliance, my recommendation for advancement is a 0.5 millimeter to 1 millimeter forward every 4 to 5 days. Again, a 0.5 millimeter to 1 millimeter forward every 4 to 5 days. If you start advancing all over the place and moving, and then I have no idea what's happening. So if you can keep a little bit of a sleep journal or a log to let me know when and where you advanced, that can be very helpful to dialing in, okay? The goal is not to advance your jaw as far as it can go. Again, the goal is not to advance your jaw as far as it can go. The goal is to advance your jaw as far as you need to go. So we need to Goldilocks it. And ideally, that is as minimally far forward as possible. Sometimes in some people, if we move their jaw too far, we start to see a decline and a worsening of their apnea. Your airway is ultimately stretching out like a rubber band as we pull and support the jaw. So it's possible that if we pull you too far and we overstretch you, we'll start to see things go backwards. So you may not advance at all, but if you are still having symptoms, we want to advance. The goal is that we've found a position that is as close to and as reasonable for you as we can so that we can retest you. Nobody wants to have more sleep tests than necessary, especially if we're utilizing your insurance, because there's a cost for every night of testing. If we're using my equipment, we can test you multiple nights, but I know that when you do a sleep test, it's not that fun. So if we've already done some of the legwork to adjust and dial you in, then we're going to have potentially better outcomes more quickly. Okay, we want to get you in the right spot as fast as we can. Now, we never want you to advance to a position that is uncomfortable. It can feel like a stretch, right? When you stretch your muscles, it's tight one day, and then the next day you stretch more, and then you stretch more. But if you're starting to feel pain, that's too far. That's also a reason for us to stop advancing. So it needs to be a little bit of a balance of something that your jaw can comfortably tolerate, but is also giving you benefit and improvement in your sleep quality. So we will work on that together, but please keep that in mind. And so again, please provide me with as much feedback as you can so that I can help assist you in finding the right position for your jaw. Once we go through all of these things and we find a comfortable and effective spot, then we stop. We do not advance anymore. If you are experiencing some drooling with your appliance, that is a normal side effect. It should improve with a little bit of time. On the other end of the spectrum, if you are experiencing some dryness, then I'm going to recommend that you utilize the rubber bands that I provided for you, and typically would have you switch a rubber band out every 3 to 4 days. If you don't like the rubber bands or they're not comfortable for you, but we need to get your lips closed so that your mouth isn't dry, you can use mouth-specific tape. You can buy mouth tape on Amazon in a box it's porous, and it will just help to support the lips closed so that your mouth doesn't dry out. With mouth tape, it's typically not claustrophobic feeling as long as your nose is not congested and you're sick. So just make sure that you've blown your nose, use saline before bed to clear out any blockage and boogers, and then you use the mouth tape, okay? For people that are opposed to both of those ideas but are still experiencing dryness, potentially I can adjust your appliance and make it shut down a little bit more so that your mouth can close a little better around it. Or you can use a product called Biotene. Biotene can be found in the grocery store, and they have mouthwashes and gels. I recommend the jelly. With the jelly, you can put a little bead in the appliance right before you put it in, and it will act kind of like a KY jelly for your mouth. It will just lubricate your mouth and keep it feeling a little bit more moist while you're sleeping. So those are some of the typical things that people often complain about, and I want you to be mindful of as you're getting into wearing your dental device. Most all of the other instructions that we talked about have been written down and provided for you, but this is always a good point of reference if you have any questions.